Okay, the next neonatal infection we're going to talk about is transplacental infections. So these are infections that cross the placenta. There's a large group called TORCH infections, and this is an acronym that's used to describe maternal infections during early pregnancy associated with various congenital malformations and disorders. Those include the ones that are listed. As far as TORCH, that acronym, T stands for toxoplasmosis, O stands for other infections, and these include gonorrhea, hepatitis B, syphilis, varicella zoster virus, parvovirus, and HIV. The R stands for rubella, C stands for cytomegalovirus, and H is herpes simplex virus. So we're going to go through the ones listed on the slide one by one, and it's quite a bit of information, but you have my notes. The first one is toxoplasmosis, and this is a multi-system disease caused by the protozoan Toxoplasma gondii parasite. It's found in cats, dogs, pigs, sheep, and cattle, but cats are the definitive host. The risk factors include contaminated soil, consumption of undercooked meats or seafood, and changing cat litter. And of all of the things with toxoplasmosis, what you need to remember is telling pregnant ladies to not change cat litter. The three key findings with the baby are hydrocephalus, chorioretinitis, and cerebral calcifications. You treat with pymethymone for 1 year. So again, just kind of follow my notes or follow along in the book. The next thing is gonorrhea. The thing about gonorrhea is many women with gonorrhea have chlamydia also. So the same risk factors, risky behaviors, sexual behaviors, and that type of thing, they usually have more than one STI. What happens is after the membranes rupture, there's an ascending infection, so the infection goes from the vagina to the uterus, into the baby's orogastric, eyes, rectal mucosa, and pharynx. It can also be transmitted by the birth canal, via the birth canal, or postnatally from infected adults, so it's important hand washing, that type of thing. Then this is why babies, one of the reasons that we give eye prophylaxis. And if the baby has a systemic infection, we also give IV antibiotics. But treatment for a baby that's been infected with gonorrhea is IV antibiotics if it's systematic, and then eye ointment if it's not. And that's one of the reasons we give the eye prophylaxis. Next is syphilis. If syphilis is not treated during pregnancy, 50% of the neonates will be born with symptomatic congenital syphilis. Risk factors include late or prenatal care, maternal substance abuse, crack cocaine use, multiple sexual partners, history of other STI, homelessness, and HIV. So those are kind of the high risk. Some of them are behaviors, some of them are living conditions. But those patients are high risk for contracting syphilis. It can be contracted, so the baby can contract it from the placenta or a lesion at birth. The risk to the fetus varies according to the stage of maternal infection. So that's the thing about syphilis and actually herpes, which we'll talk about, but depending on which stage of the disease is how the baby is affected. If there's delayed or no treatment, the result can be anything from minor anomalies to preterm birth or even fetal death. The baby may be symptomatic at birth, or they may not have any symptoms until they're 20 years old. So it can be a dormant infection that takes years to surface. Signs and symptoms are prematurity, hydrops, failure to thrive, hepatosplenectomy, jaundice. There are certain characteristic bone lesions, snuffles, copper-colored maculopapular dermal rash on the pads of the hands and the soles of the feet. So the palm of the hands and the soles of the feet. That rash is very characteristic of syphilis. Medical management include lumbar puncture, CBC, long bone radiography to check for those characteristic bone lesions, and penicillin. Treatment is more effective if it begins early. Potential complications that result later, so 5 to 15 years later, are neurosyphilis, deafness, Hutchinson teeth, which are notched incisors, saber shins, joint involvement, saddle nose, dumus, interstitial caritis, and then there were a list of other in the book. So just kind of have a general understanding of syphilis and the signs to look for if a baby's born with syphilis. The varicella zoster is the next one, and this is the virus that's responsible for chickenpox and shingles and is also a member of the herpes family. When maternal infection occurs in the last 3 weeks of pregnancy, 23% of the infants develop clinical varicella. The severity of the infant's illness increases greatly if the maternal infection occurred within 5 days before or 2 days after birth. So if that's when mom has her infection, then the baby's at higher risk. The mother should receive immune globulin within 72 hours of exposure. Infants should receive the varicella zoster immune globulin at birth. The treatment is the antiviral acyclovir, and it can treat generalized involvement. So acyclovir would be the drug of choice. And then the last neonatal infection that we're going to talk about on this slide is hepatitis B virus. So mothers with hepatitis B virus have a high rate of premature birth. The transmission rate is 90% when the mother is seropositive for both hepatitis B surface antigen and the hepatitis B E antigen. Transmission occurs transplacentally, serum to serum, and by contact with contaminated body fluids. Can also be transmitted via breast milk. However, due to the antigens that the baby gets through breastfeeding is not contraindicated. The risks include chronic hepatitis, cirrhosis of the liver, and liver cancer even years later. Infants should receive both the Hep B vaccine and the Hep B immune globulin if the mom is positive, of course, for the hepatitis B virus. So I think the interesting thing about some of these is, the baby may be exposed at birth, but may not have any kinds of signs or symptoms for years later. This first picture shows neonatal syphilis lesions on the hands and feet. And the second picture shows neonatal cytomegalovirus on the face. The next torch infection we're going to talk about is HIV and AIDS. The incidence of mother-to-child transmission is 1%, which is fabulous and so low, and it's due to all the prevention strategies that we know are effective and that we implement. Strategies include treatment during pregnancy and labor, treatment of the neonate for 6 weeks, and delivery by an elective C-section if the mom has high viral loads present. So these births are there's a lot of strategy that goes around them. It's a planned C-section, and they even call it a bloodless C-section, so they decrease the amount of exposure to the baby as much as possible. In the United States and Canada, breastfeeding should be avoided. And that's because HIV does cross through breast milk, but it's recommended in developing countries. Formula is much more readily available in the United States, Canada, those type of countries, but in those countries, the developing countries where the formula is not available, really breastfeeding is the only option. Transmission most often occurs at birth and breastfeeding in developing countries. The most accurate test is the HIV-1 DNA PCR. The age of onset of symptoms predicts the length of survival. So if the baby is symptomatic within, days or weeks of birth, they're not going to have as long of a life expectancy as if, the child doesn't show signs and symptoms for years later. Symptoms may appear within 48 hours or as long as 8 to 10 years of age. You treat with highly active retroviral therapy, so HAART is what it's called. And of course, after we had class, I realized you all have not had HIV and AIDS. It's a very in detailed disease process, but I've kind of given you the highlights that you need to know. Signs and symptoms include growth failure, upper respiratory infections, swollen lymph nodes, swollen spleen, fever, diarrhea, dermatitis, pneumonia, and thrush. And there's also many others, but just think these babies and these kids and parents are immunocompromised, so they tend to pick up every little viral, bacterial, and even yeast infection that's out there. Next, we're going to talk about rubella infection. And since vaccination began in 1969, the number of cases have reduced drastically. More than 2/3 of infants show no symptoms, but the sequelae can develop years later. Hearing loss appears to be progressive after birth. Congenital rubella syndrome includes cataracts or glaucoma, hearing loss, and cardiac defects. The infected infant should be isolated until their mucus and urine are free of virus. So that would basically be how you would treat the babies in the nursery. Next one is cytomegalovirus infection. It can result in miscarriage, stillbirth, or congenital cytomegalovirus inclusion disease. It's the most common cause of congenital viral infection in humans. Signs and symptoms include IUGR, microcephaly, which is a small head, seizures and lethargy, rash, jaundice, and also involves the spleen. It also causes cognitive delays, hearing loss, visual impairment, and a defect in the tooth enamel. Treatment is ganciclovir, or a CMV-specific human immunoglobulin to the pregnant patient. So again, this is a virus and it's treated with an antiviral. Next is the herpes simplex virus. Women with a history may be prescribed antivirals starting at 36 weeks. It's acquired through transplacental infection, ascending infection of the birth canal, direct contamination during birth, or direct transmission from the infected person. Scalp electrodes break the fetal skin barrier during labor and increase the risk of infection. So if you know a mom has a history of herpes, you never use internal monitoring on them. Primary maternal infections after 32 weeks present a higher risk for newborns. So when it comes to the herpes simplex virus, the primary outbreak, the first outbreak, is the most lethal to babies. So especially if the primary outbreak is after 32 weeks. Subsequent outbreaks are not as lethal to the babies. Neonatal HSV infections are classified as disseminated infection, which causes sepsis-like symptoms, CNS disease, which affects the brain, or localized infection of the skin, eye, or mouth. You should always wear gloves when caring for these babies, and treatment is with acyclovir. And in my notes, I've put in italicized, and this is related to the maternal STIs, that signs and symptoms in women include painful, recurrent genital ulcerations, and you treat the moms with acyclovir also.